Good morning, friends. Welcome to our next learning session. About 15 years back, a 50-year-old female was brought to me with a complaint of having a gland in the neck. She had actually gone to a big hospital and kept sitting there for 4 hours waiting for the physician to come. Then her sister went there and brought her back, and next morning they came to me. I examined her and found that it is not one gland. These are two glands which have joined together. We call it medically, they are matted glands. And in medical practice in India, matted glands means tuberculosis. So diagnosis was clear, but the hospital wanted to go a little more proper way. They want to take a fine needle aspiration. It is called FNA, fine needle aspiration, and then the aspirated material is sent to the laboratory where histopathological examination is done and diagnosis of tuberculosis is established. Here, important thing is that with our experience we know that this is a tuberculosis, and I put the patient on tuberculosis. But I was careful before putting her on tuberculosis, anti-tuberculosis treatment. I asked for liver function, kidney function tests and hemogram, ESR. All these tests, it was my routine practice that to get these tests done before starting the treatment. 1 month later, I again got her blood tested and there was no untoward effect. Then at 1.5 months again we tested and no untoward effect. At 2 months I asked for liver function test and the little laziness on the part of the patient caused her a lot of problem. She went ahead with 2 more days before I could see the report, and I found that her SGOT and SGPT were raised. So I asked for a complete liver function profile. Meanwhile, the patient had developed puffiness of face, swelling over the feet, ankles, tibial region, just below the knee joint. She had fluid in the peritoneal cavity and pleural cavity. In other words, she had developed generalized anasarca. Friends, generalized anasarca is the collection of fluid, water, in various potential spaces in the body. Potential space, we say that normally we do not find a space, but there is a space. So that is why it is called potential space. I may tell you that I had put the patient on standard anti-tubercular drugs which included rifampicin, Isonex, ethambutol and pyrazinamide. These are recommended depending upon their mode of action. They are selected and recommended by even WHO. So our treatment regime was correct and our approach was correct, but because patient did not take it seriously, she went into liver decomposition. So I immediately ordered for a CT scan and found there were some big nodules all over the liver, telling us that it was a case of cirrhosis of liver. Now, before I tell you more about the patient, I want to show you some diagrams here. See this. This is the neck of the patient. See, this is a big gland. I can make it out here like this. You can see in the neck, this is a big gland. Again, see, I can make it as close as possible to the screen, and you see this is a gland in the neck. See another diagram here. here is the gland. You see this prominence which you are seeing from here to here. This is a muscle. This is a muscle in the neck. This is going like this here, and this is little towards the inner side of the muscle. This area, this is the gland. Let us make it close. This is the gland which we can see here. This is also tuberculous gland. Then when we got a CT done, we found big lumps or nodules in the liver. Let us see, these are the nodules. See, these are the nodules. I am touching with my pencil. These are the nodules, 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 nodules. So many nodules. Here also there are nodules, nodules, nodules. Then I show you another diagram. Here also you find this is the normal liver and this is a diseased liver. You see, these are small, these are nodules which are not present in this diagram. See closely. There is no nothing here, but there are nodules here. Now, friends, the patient had been put on anti-tuberculosis treatment, and I had got the liver function test done before, and then 1 month and 1.5 months, but at 2 months she developed a raised SGOT, SGPT, and I asked for a full profile, which I was not shown, and patient continued the treatment for another 2-3 days before she came to me, and by this time she had developed generalized anasarca. As I said before, generalized anasarca means presence of fluid almost every potential cavity of the body, potential space which is present. In this case, there was swelling over the feet, over the ankles, over the legs. There was a puffiness of the face. There was a fluid in the tummy. There is those of you who have some connection with the medical side, they know that there is peritoneum and there is pleura and there is pericardium. Fluid can enter in the pericardium, it can enter in the pleura, it can enter in the peritoneum. The fluid present in the peritoneum is called ascites. The fluid present in the pleura is called pleural effusion, and present in the pericardial membrane is called pericardial effusion. So practically everywhere the patient had this collection of fluid, and of course she had gained lot of weight. Having made this diagnosis of cirrhosis of liver, I again went into the details of the history, and I found that during her school time, somewhere 9th, 10th year, she had dead fever and lot of vomiting, for which she had to be hospitalized in a peripheral hospital, and where they gave her glucose and she made recovery. Her vomiting disappeared and patient was sent home. No liver functions were done at that time. So with this history, I could make out that this was an attack of viral hepatitis, and this viral hepatitis resulted in cirrhosis of liver over so many years, which the patient did not have any symptoms. Even at that time of hepatitis, patient did not have any yellowness of eyes, that is, the patient did not have any jaundice. So this patient now came to me. It was a cirrhosis of liver in decompensated stage, and as the medical teaching is that if there is a precipitating factor, then you remove the precipitating factors, the recovery is good. The prognosis, we say, is favorable if you remove the precipitating factors. Here the precipitating factor were the hepatotoxic drugs. Rifampicin is hepatotoxic, Isoniazid is hepatotoxic, and pyrazinamide is also hepatotoxic. So we were giving 3 drugs which were hepatotoxic, and patient went into hepatic failure. But as we stopped all the drugs, the patient started making recovery. But before patient could make recovery, I had to shift the patient to a liver unit, which was being run by my own professor of gastroenterology. So I was thinking the patient is in competent hands. I discussed the case with the head there, and he was also of the opinion that the patient has got less of illness due to the liver failure and some more of anxiety neurosis, because her father had died because of cirrhosis of liver, and this was something very important when she came to know that she herself has got cirrhosis of liver. So negative thoughts started coming, and she was totally in anxiety. We kept her for a night in the intensive care, and then we shifted her into the room to remove her anxiety. We have been trying all things, and ultimately I told the patient something which helped her. This thing was not actually appreciated, but I was acting only as a doctor, and I told her, why you are spending so much money when you don't have any illness? And that made her a change, and she started making a recovery. And now it is as on today also I am in touch with the patient, and patient is doing fairly well. She is perfectly normal, no further problem. What is important in such cases is that they must not get involved into those things which can precipitate liver failure. So friends, there was a case of tuberculous lymphadenitis where metal glands were present, where anti-tuberculous treatment was given. Remember, these anti-tuberculous drugs are hepatotoxic. Hepatotoxic means they are injurious to the liver. They can cause damage to the liver, but the treatment was essential. These drugs were given, and since she had underlying cirrhosis of liver which got decompensated, and she had to suffer this much. If we take care of this type of thing, a lot of problem can be solved out. I remember having seen many foreigners who come, and I'm called to see them, and find that they have vomiting and fever, and I tell them to get the liver function test done, because I explain them that if it is gastroenteritis which is causing them fever and vomiting, then there is no problem. But if it is hepatitis, they could get into the problem like the case I have just described. So all these patients I will verify by liver function test that they don't have hepatitis. So friends, be careful in treating such cases, and be careful if you can dwell with such situation. You ask for that my liver should be tested, and then proper treatment should be given. If at all you are being given anti-tuberculosis treatment, it is better to spend a little more money and get periodic liver function tests done. That will go a long way in saving you money from the disease as well as from the hospitals. Thank you very much. Continue your support by subscribing, commenting, and giving suggestions and likes. But please, again I am saying that don't give your reactions or remarks or comments or thumbs up on the messenger. You please do this on the after opening the link. Do it on the YouTube, and that will be a good communication between you and me. Thank you very much. We will meet next time with another new case.